on the heels of a fantastic Friday at HSC, raising a record $520,000 plus for innovative healthcare. The announcement today with the foundation and the provincial government of the next generation of Gamma Knife. In a moment, two guests from the foundation will join us. We begin with neurosurgeon Dr. Anthony Kaufmann of Health Sciences Centre. Doctor, tell us about the Gamma Knife.
Well, the Gamma Knife is a remarkable tool that was developed 60 years ago. We got the first Gamma Knife only 23 years ago here in Winnipeg, the first in all of Canada. And what the machine does is focuses almost 200 rays of cobalt radiation precisely on a target, typically a tumor inside the head. And the Gamma Knife that we've had in the last 23 years, we've had several upgrades to it, and it's had great capabilities to treat patients. We've treated 5,000 patients already. And in fact, Gamma Knife radiosurgery comprises about 25% of all brain surgery in the province. With this new Gamma Knife, however, we have additional capabilities. This Gamma Knife allows us to treat these patients more quickly, therefore more efficiently, more effectively, and still get the same great outcomes. For patients, they may come in the morning after breakfast for the Gamma Knife surgery and go back home at lunchtime. In the past, patients would be in our Gamma Knife unit the entire day. So there's an increased efficiency. We also have other capabilities. We can treat larger tumors now. We have option of some increased flexibility and comfort for the patients, where we can choose between a rigid frame or a custom-fitted mask to immobilize the head during the treatment. And finally, the Gamma Knife has a built-in imaging arm, so we can actually confirm with a picture the position of the patient's head and their target, tumor, for example, and not need to rely heavily on the hospital-based diagnostic imaging services, because we do the imaging right there on the Gamma Knife table. This frees up the MRI and CT scans for other patients who are waiting for imaging studies.
And that's way more efficient. And in this way, you can make sure that the Gamma Knife has got everything, correct?
Absolutely. This is the most advanced version of the Gamma Knife, called the Gamma Knife Esprit. It allows us to do really everything we hoped we could do. We've been using it for a year now already, treated about 250 patients with this new unit, and it's met all our expectations. And we're still learning, as is the international community, on how to best treat patients, particularly patients now who are living longer and longer with cancers, for example, and successful chemotherapies, immunotherapies, targeted therapies. We're treating their brain metastases so they can continue to live happy and healthier lives.
Dr. Anthony Kaufmann of Health Sciences Centre in Winnipeg. We're joined by two guests on 680 CJOB. Katie Hall Hursh is chair of the HSC Foundation Board of Directors, Jonathon Lyon, president and CEO. Thank you both for joining us. Katie Hall Hursh, when you tell people about the next generation of Gamma Knife and all the other technology that you're trying to raise money for, I would imagine there's not too much resistance in trying to be part of the solution, correct?
That's absolutely right, Richard. It's from, we heard from Dr. Kaufmann from 2003. So 23 years ago now, we had one of the very first Gamma Knives in Canada, and the sense of pride that we had as Manitobans to be able to say that we were the first and the best. It's the same thing that's happening all over again, where we can say we have the very best equipment available to treat Manitobans, and do so in a more efficient, more targeted manner, so people are getting home to their loved ones that much faster. So you really don't have much pushback from donors, and that they know that by giving to the foundation, they can be a part of such a impactful solution. Yeah, in the case of the Gamma Knife, you can go after breakfast and be home just after lunch, as opposed to a full day surgery. That is so very efficient. Jonathon Lyon, how do you folks determine what's next as far as the innovations that you need? Take us through that process, if you will.
Thanks, Richard. You build upon past successes. So all of these, the Gamma Knife, which we're thrilled to announce today, the backdrop against that is, a year or so ago, we announced the first surgical robot in Manitoba that our foundation bought in collaboration with the government. And before that, we've done a number of projects that have allowed Manitobans to get better care sooner, better outcomes, shorter hospital stays, return to their family, to their work, and all those sorts of things. And so you just build upon the success of those. So you have, I'm a big believer, if it ain't broke, don't fix it, in the sense of the manner in which we come up with projects. We work and talk to frontline people every day at the foundation. We work in collaboration with the government, with HSC and Shared Health, because we're not some sort of rogue entity. We have to collaborate with our funding partners to ensure that everything that we look at to approach the community for fits into a larger plan. And we've done that with success. I'm very proud of that. And our, as Katie said, our donors respond. They want to be part of the solution. This is the Canada Health Act, a publicly funded healthcare system. Donors want to have an impact ensuring we have the best technology so that we can attract and retain the medical professionals for our time of need.
And Katie Hall Hursh, I would imagine that when you have those meetings and you ask, okay, what's next, then it's a pretty concerted and focused effort on trying to raise, specific dollars for a specific piece of equipment, or it might be a renovation. But the aim here really is to reduce wait times in so many parts of the healthcare system at HSC.
And that's right. And we're doing exactly that through introducing these innovative technologies. We're having the ability to have really system-wide impact, from reducing wait times at the very front door of our emergency rooms, because we're allowing for better throughput and freeing up bed space, bed capacity. We've talked a lot about that, Richard, about our robotic surgeries and how that's allowing our neighbors, our friends, to be going home within, same day, in some cases next day, when that previously would have been a week-long stay. And that's freeing up bed space to allow people to move through from the emergency room if that's the kind of care that they need. And so that's really what we're trying to do at the foundation, is understand where we can mobilize donor dollars to have the greatest impact by really leaning into those parts of the innovation technology and the spaces. As you say, it's important also to have the spaces to house them. And we understand that that's what's important to our donors, and we know certainly that's what is important to our care teams. They want to be able to do their very best work and use the technology to do it. Yeah,
we've said that Mona, the robot, surgical robot, needs some siblings here, so I'm sure you folks have your marching orders on that. Jonathon, I wouldn't be doing my duty here if we just revisited last Friday, record-breaking $520,000 plus here, and I would imagine the money kept on rolling in after our 6 o'clock deadline.
Yeah, it did, and so the 525 and change increased by another 10 grand, and earlier today I saw another donation roll in. So we encourage Manitobans to continue their support of our foundation, because we assure you that your dollars will be invested in helping yourselves, your friends, and your loved ones get better patient care sooner at Manitoba's hospital, the Health Sciences Centre, which is the backbone for our acute tertiary system. If Health Sciences Centre isn't working, healthcare is not going to work anywhere, and we can target investments that save lives and improve lives.
Thank you both for joining us, and again, congratulations on today, and a big shout out for all those people that were a part of Friday. Thanks again.
Thank you very much.
Jonathon Lyon, President and CEO of the HSC Foundation. It's Chair of the Board, Katie Hall Hursh, joining us live.